If your teeth are looking more yellow than they used to, it may not be because of coffee, tea, or how often you brush. For many adults over 50, tooth discoloration can be a quiet biological signal, one that starts inside the body, not on the surface of the tooth. Most whitening products are designed to scrub or bleach what you see, but they don't address why stains keep coming back. Over time, that approach can actually make teeth more sensitive, more porous, and easier to stain again. My name is Dr. Nelson, and for many years I've worked with older adults who were frustrated by the same cycle: whiten, fade, repeat. What most people are never told is that tooth color is closely connected to the chemistry of your mouth, especially saliva and mineral balance. When that internal environment changes, no amount of surface whitening can create lasting results. In this video, I'm going to walk you through a natural, science-based approach that focuses on protecting your enamel while supporting the conditions your teeth need to stay brighter over time. We'll start by looking at the real reason teeth discolor as we age, something that's often misunderstood but surprisingly simple once you see it clearly. Think of this as one complete home remedy made of 3 gentle steps that work together, not 3 quick fixes. Stay with me, because understanding this first step will change how you think about tooth whitening from this point forward. 1. Why yellow teeth are often a quiet signal of internal change. If you're over 60, yellowing teeth can feel like one more reminder that your body isn't working the way it used to. Many people in this stage of life brush twice a day, keep regular dental appointments, and still notice their smile slowly losing its brightness. That can create a quiet worry, not just about appearance, but about what this change might be saying about overall health. Most older adults don't talk about that fear out loud, but it's there. What's important to understand is that teeth don't age in isolation. Tooth enamel is living mineral tissue, and it responds to the chemistry of your mouth every single day. As we get older, saliva production often decreases, digestion can slow, and mineral absorption may not be as efficient as it once was. When that happens, the mouth can become more acidic without you realizing it. In an acidic environment, enamel becomes slightly more porous, making it easier for stains to settle in and harder for teeth to naturally protect themselves. This is why yellow teeth are not always about hygiene or the foods you enjoy. Many seniors quietly blame themselves, thinking they've done something wrong or haven't been disciplined enough. That self-blame can lead to overbrushing, aggressive whitening, or frequent use of chemical products. Unfortunately, those actions can thin enamel even further, increasing sensitivity and accelerating discoloration over time. This matters most when whitening becomes a routine fix instead of a thoughtful choice. Repeated surface whitening without addressing the internal environment can create a cycle. Temporary brightness followed by faster staining, more sensitivity, and growing frustration. For someone already managing blood pressure, digestion changes, or dry mouth, this cycle adds unnecessary stress and confusion. The good news is that understanding this connection gives you back control. Yellowing teeth don't mean you're failing at self-care. They mean your body may be asking for a different kind of support, one that respects aging biology instead of fighting it. The first step is to pause, stop attacking the surface, and start paying attention to what your mouth chemistry is telling you. And this brings us to the next important question. If the problem isn't just on the surface, what is the safest way to clean and support your teeth without damaging the enamel you still have? That's exactly where we're headed next. Trick 1. Gentle surface cleaning that protects your enamel. For many adults over 60, the idea of cleaning stains can trigger a quiet fear. What if I make my teeth worse? You may already deal with sensitivity, thinning enamel, or gums that don't recover like they once did. So when stains appear, the instinct is to scrub harder or reach for stronger products, even while worrying that one wrong move could permanently damage your teeth. This is exactly where many well-intentioned people get trapped. Aging enamel is not fragile in the sense of being weak, but it is less forgiving. Years of normal wear, medications, dry mouth, and mineral shifts mean your enamel no longer rebounds the way it did at 40. When aggressive whitening or abrasive toothpaste is used too often, the surface may look brighter briefly, but the structure underneath becomes rougher and more porous. That roughness actually gives stains more places to cling to later, creating a frustrating cycle. A safer approach focuses on supporting the surface rather than stripping it. Gentle, infrequent surface cleaning can help remove buildup without triggering enamel breakdown. This is not something to do daily, and it's not meant to replace regular brushing with a soft toothbrush. It's best used when you notice a dull film or mild discoloration that doesn't respond to normal hygiene, and it should be avoided entirely if you're experiencing active gum pain, open sores, or severe sensitivity. What matters most is restraint. Older adults often feel pressure to fix things fast, especially when changes in the body start stacking up. But with teeth, slower and gentler is safer. Overuse, even of natural methods, can still lead to irritation or imbalance if done too frequently. The goal is to clean just enough to reduce surface buildup while preserving the enamel you still have. After watching this, the most important action is not rushing to try everything at once. Choose one gentle method, use it sparingly, and pay attention to how your mouth feels over the following days. Comfort, not just color, is your best guide. If sensitivity increases, that's a signal to pause, not push through. This careful surface-level support sets the stage, but it's only part of the picture. Even when the surface is treated gently, stains will keep returning if the environment inside the mouth stays unbalanced. And that leads us to the next step, one that works deeper than the tooth surface and addresses what's happening in your mouth every single day. Trick 2. Supporting the oral microbiome naturally. After taking a gentler approach to surface cleaning, many adults over 60 still notice something feels off in their mouth. Even when teeth look a bit cleaner, there may be lingering bad breath in the morning, gums that bleed too easily, or a sense that the mouth never feels truly fresh. These changes often create a quiet anxiety. People start to wonder if this is just normal aging, or worse, a sign that something deeper is going wrong. What's rarely discussed is that the mouth has its own ecosystem. The oral microbiome is a delicate balance of bacteria that protect the gums, support saliva quality, and help keep teeth resilient. As we age, this balance can shift due to medications, dry mouth, changes in digestion, or years of using antiseptic mouthwashes that kill both good and bad bacteria. When harmful bacteria gain the upper hand, stains bind more easily, gums stay inflamed, and whitening efforts stop lasting. This is where oil pulling can play a supportive role when used correctly and selectively. Oil pulling is not a replacement for brushing or dental care, and it's not something to do aggressively or daily. It's most appropriate for older adults who notice chronic dry mouth, recurring plaque buildup, or gum sensitivity without acute infection. It should be avoided if there are open sores, difficulty swallowing, or jaw fatigue that makes prolonged swishing uncomfortable. The fear many seniors carry is doing harm without realizing it. Swishing oil too vigorously, doing it too often, or swallowing the oil afterward can cause discomfort or digestive upset. Used improperly, it becomes another example of trying too hard and stressing an already sensitive system. Used gently and occasionally, however, oil pulling may help bind unwanted bacteria and reduce the microbial load that contributes to inflammation and discoloration. The key action after watching this is simplicity and awareness. If you choose to try oil pulling, do it slowly, for a limited time and only once or twice a week. Pay attention not just to how your teeth look, but how your gums feel and how your mouth responds the next morning. Improvement should feel calming, not irritating. And even with a healthier oral microbiome, there is still one missing piece. Because as long as the chemistry of your saliva remains off balance, bacteria and stains will continue to return. That deeper internal environment is what we need to address next, and it's where lasting change truly begins. Trick 3. Balancing saliva pH from the inside. By this point, many adults over 60 begin to realize something important. Even with gentler cleaning and better care of the mouth surface, changes keep returning unless something deeper shifts. This realization can bring mixed emotions. On one hand, there's relief. Maybe I'm not doing everything wrong. On the other, there's a quiet worry. What if this means my body is struggling in ways I can't see? Saliva plays a much larger role than most people are ever told. It's not just moisture. Saliva helps neutralize acids, delivers minerals back to the enamel, and keeps bacteria in check. As we age, saliva production often declines, especially in people taking medications for blood pressure, heart health, sleep, or allergies. When saliva becomes more acidic or insufficient, the mouth turns into an environment where enamel weakens and stains bind more easily, no matter how carefully you brush. This is where misunderstanding can cause harm. Many seniors respond to dryness or staining by using stronger mouthwashes, frequent whitening, or constant snacking to stimulate saliva. Unfortunately, these habits can push saliva pH even further out of balance. Acidic drinks, frequent grazing, and dehydration quietly keep the mouth in a state where enamel never fully recovers. Over time, this can increase sensitivity, gum irritation, and the feeling that your teeth are aging faster than the rest of you. The shift that matters most happens gradually and from within. Supporting hydration, mineral intake, and digestion gives saliva the tools it needs to do its job. This approach is best applied when staining seems persistent despite good hygiene, or when dry mouth, reflux, or taste changes are part of daily life. It may not be appropriate during acute illness or periods of poor appetite when the body needs stabilization first. The most important action after hearing this is to slow down and observe. Pay attention to how often your mouth feels dry, especially overnight. Notice whether your teeth feel rough by the end of the day or smoother in the morning. Small adjustments, drinking mineral-rich fluids, spacing meals, and choosing foods that don't constantly acidify the mouth, can quietly shift saliva chemistry over time. This internal support doesn't create overnight whitening, but it changes the rules of the game. When saliva pH improves, stains stop sticking so easily, and the work you've already done finally has a chance to last. And that leads to the final question many people are asking by now. If you support the surface, the bacteria, and the internal balance, what should you realistically expect to notice in the first week? That's exactly what we'll look at next. 4. What you may notice after 7 days of doing this the right way. By the end of the first week, many adults over 60 begin to notice changes that feel subtle but meaningful. This is often the point where quiet skepticism turns into cautious relief. You may not see a dramatic before and after in the mirror, but you may sense that your mouth feels calmer. Teeth can feel smoother when you run your tongue across them, especially in the morning, and the heavy film that used to return by midday may be less noticeable. For people who've lived with dry mouth or persistent bad breath, that alone can feel like a small victory. This stage matters because it addresses a common fear among older adults. What if I try something new and nothing changes? Or worse, what if I make things more sensitive? When the steps are followed gently and in moderation, the first 7 days are not about forcing whitening. They're about observing whether your body responds with less irritation, not more. If sensitivity decreases, gums feel less tender, and staining seems slower to return, those are early signs the environment in your mouth is improving. It's important to be clear about when expectations should be adjusted. If you're dealing with advanced gum disease, severe enamel loss, or untreated dental issues, changes may be less noticeable at first. In those cases, these steps are supportive, not corrective, and professional guidance remains essential. The goal here is not to replace dental care, but to stop unknowingly working against your own biology. Misunderstanding this phase can lead to disappointment. Some people push harder after a few days, hoping to speed things up. That usually backfires, leading to irritation and the false belief that natural methods don't work. In reality, aging tissues respond best to consistency, not intensity. Progress often shows up first as comfort and stability, then as appearance. The most helpful action at the 7-day mark is reflection. Ask yourself how your mouth feels compared to a week ago. Is dryness less frequent? Does brushing feel easier? Are stains slower to settle in? If the answer is yes, you're moving in the right direction. If not, it's a signal to pause, simplify, or reassess rather than escalate. And this brings us to the final piece. Once you understand what realistic early progress looks like, the bigger question becomes how to protect these gains over time without adding stress or complexity. That's exactly what we'll bring together in the closing message. 5. Final thoughts: protecting your smile by protecting your health. As we grow older, the body becomes more honest with us. Small changes that once went unnoticed, like tooth color, dry mouth, or morning discomfort, begin to speak louder. What this journey has shown is that teeth are not separate from the rest of you. They reflect balance, hydration, digestion, and the quiet chemistry that keeps tissues resilient. When that balance shifts with age, the body doesn't always send dramatic warnings. Instead, it whispers through subtle signals, and stained teeth can be one of them. For many older adults, the instinct has been to fight these changes at the surface. Scrub harder, whiten more often. Try to restore what used to be. But the deeper lesson is that aging tissues are less tolerant of force. Men and women over 60 often carry an unspoken fear. What if one small mistake causes permanent damage? That fear is valid. Enamel does not regenerate easily. Saliva changes overnight, and the body's ability to rebound slows, especially during sleep when repair should happen, but sometimes doesn't. This is why understanding matters more than intensity. When you recognize how surface care, oral bacteria, and saliva chemistry work together, you stop reacting and start responding. Gentle cleaning protects what remains. Supporting the oral microbiome reduces silent inflammation. Improving internal balance helps saliva do its job again, especially overnight when dry mouth and acid exposure can quietly undo progress. These steps are not about perfection. They are about alignment with how the aging body actually works. Looking ahead 1 to 5 years, the choices you make now can shape more than your smile. A calmer oral environment supports better sleep comfort, fewer morning irritations, and less reliance on harsh products that create cycles of sensitivity. Over time, this can mean fewer dental complications, less stress around appearance, and more confidence in daily interactions. Just as importantly, it reinforces a mindset of prevention. Catching small imbalances early instead of waiting for larger problems to appear. Aging does not mean losing control. It means choosing a different kind of control. One based on awareness, patience, and respect for your body's limits. When you understand the signals and adjust thoughtfully, you protect yourself not just from stains, but from the quiet risks that come with misunderstanding how your body changes over time. Your health in the years ahead will be shaped by how well you listen now. When you stop fighting symptoms and start supporting systems, the body often responds in ways that feel steadier, safer, and more sustainable. And that is the kind of progress that truly lasts. If this helped you see your smile and your health more clearly, take a moment to reflect on what your body has been quietly telling you and stay with me as we continue learning how to protect it the right way.